So thank you so much, the conference organizer for accepting my abstract, and also thank you for accepting my accept for presentation by oral presentation by online or virtual mode. So once again, I thank you. And as I said in the previous presentation, I'm basically researcher and healthcare provider. I claim because I'm researcher and I have done a lot of research on health aspects of women and girls in general and sexual reproductive health of women and girls in particular. So thank you so much for providing it. So this is my second presentation which I'm making before you, which is the conference at the conference which is taking place in Singapore on March 27, correct? Yeah, March 27. I was mistaken. I thought it was taking place on March 28 because I had some confusion because of some my health issues in my family. So thank you so much, and once again for providing me the opportunity for making my presentation in virtual mode and sorry, online presentation for online oral presentation. And this, as you all are aware, that this is my second presentation. In first presentation, I spoke about the social aspects of pediatric health. So in my second presentation, I'll be talking about pediatric as a management in Switzerland as a case study. So as we know that pediatric health is an important aspect of total healthcare management. And since I've done hospital healthcare management, I have a strong view that providing health care to both boys and girl children is of very importance. And equally, it is equally important to provide them with the type of health literacy or health education they need. So this is a point I'm making before you. So providing health education, health literacy is very important. As I said in the previous presentation that I was in USA about 13 years back where I was involved with a conference on health literacy. So health literacy is very important, and the SNDT Women's University where I was working, I was involved with a lot of health education programs, including healthcare surveys to know the health needs of people in the area, not in terms of health needs of pediatric or children, which is the focal point of this conference. But I was involved with that, and I was also involved with. I'm very happy to share with you that I was also involved with one study, research study, which is named as knowledge of people about family and healthcare issues on healthcare video which is prepared by Ministry of Health. Now it will be renamed, I don't remember the new name of the government of India. So I've done a lot of research on health issues, and I strongly believe that health providing the type of health needs, healthcare need which people need, and also providing the health literacy education to the children, including the parents, in the language which they understand. It's very important, and it becomes more important in view of the fact that the health foundation of children during their school or college days, that becomes a foundation for their overall health profile of the overall profile which they will experience in the literacy of their life. So once the health children, both boys and girls, men and female and boys and girls, which they are in better health, both physical and mental health during the school or preschool days or college days, that becomes very important. And the World Health Organization, WHO, including the UNICEF, United Nations Children Fund, and United Nations, even including the government of India. I'm the resident of, including the government of Switzerland, where I'm talking more about the pediatric of minor children, that this becomes very significant. And in the context of my presentation, I would say that the objective of my presentation is to present before you the brief relevant management aspects of the pediatric health management in Singapore. And since I am talking about Singapore, so my work becomes case study in nature. Okay, and I hope you agree with me on this point. And also, the type of data which are used in my work is secondary in nature. And the method of analysis of data which are used in my work is descriptive, including non-statistical and non-mathematical. And in my work, I have used data only from sources which have been published, authentic in the sense that there are a lot of data, as we all know, that is available on the website. They are not authentic or correct, but I use data only from authentic sources, including publications of Government of India, publications of the World Health Organization, WHO, publications of UNICEF, United Children Fund, and publications of United Nations, UN. So these are only the few. I have not submitted outline details about all these things in my presentation because the word limit of 500 limit. But I have used data on that, and I said I have used secondary data, and I have used. I have not used any. I have used only descriptive method for research data. So, but in my presentation, I say that children's and pediatric health are very important, utmost important. I think all medical doctors, healthcare providers, and including nurses in nursing care institutions, including in Singapore, including countries in Asia, in Europe, in Caribbean countries, in US, in Latin American countries, we all need to join hands together to ensure that we provide the best of the healthcare services, the type of healthcare services which children need during their school or college days. And actually, as I said in the previous presentation, there also should be a need of mechanism for monitoring and evaluation, because we should not go wrong somewhere. In case if I am a project manager of project, something go wrong, I must know where I have gone wrong, so that in the next project I take corrective measures. I speak slow because sometimes I apologize. Sometimes I am blamed for talking too fast, being Indian, so I speak slow. Sorry, I apologize for distraction. So, in my presentation, when we talk about pediatric health management in Singapore case study, so pediatric health is important for both boys and girls in all aspects of the country. But in the country of Singapore, I think I'm addressing to all the country participants. I'm of the strong view that in Singapore, the role of private doctors in primary health and private doctors and private health providers is strong in not sorry, not Singapore, Switzerland, Switzerland, and they have a strong role to play. It has own, but at the same time, I must say that it has own advantage and disadvantage. In terms of advantage, it may be they have more flexibility, they are not have to be governed by government rules. But in terms of disadvantages, this is my presentation. I apologize. Somebody can correct me while making around this report. In terms of other negative aspects, maybe there is not enough. Sorry, I'm not getting. We are not getting enough support from the government organization, especially after COVID-19. The health infrastructure all over the world has collapsed to greatest strength. I hope you all agree with me. So that the entire community, government job, getting some this is what I'm getting. So when I retired in June 2000 last date, so that was also a big challenge for the healthcare providers, COVID-19. But after that, this situation, I'm telling with due respect with the honorable President of our United States, Donald Trump, including the President, Prime Minister, one member of that. I'm sorry, we getting some local call. So I must be respected. I do not want to disagree anybody because I must respect the Prime Minister President of the country. So, but my concern is that providing the healthcare services which they need people, including boys and girls need, including the type of health literacy information or health literacy services they need. It should be priority for all healthcare providers, including me, including all school teachers and take care of them. And it is very important. But Switzerland is a part of the European country. I have traveled to Switzerland. I have traveled to Zurich in Switzerland. I traveled around 3 4 years back. I don't know exact date, but it's a beautiful country. And the government has a strategy wherein healthcare in the private sector have more important role to play. What exactly the reason? To be honest with you, conference participants and conference speaker, conference manager, I am not aware of that because my work is based on secondary attendance. But I have a good experience and providing healthcare sector in the private sector is a good thing, except that unnecessary infrastructure may be a big challenge. But that's a challenge not only for Switzerland, it's a challenge for many countries in the world. And but we all need to focus more on healthcare infrastructure and more on health care infrastructure of children because the type of services and the type of services and the type of health education or health literacy provided to children that I just said in the presentation that becomes a foundation stone for children in the rest of their life. So that's very important. So we all should emphasize. And through this presentation, I request all stakeholders, including all ministers and other healthcare providers that participate in the campaign, to focus more on health of children. The health of children, not only health of children, health of everybody of more importance. But I will think that emphasizing more on health of children that was more important, especially after COVID-19, where people are not getting there is a lot of financial crisis, and people do not have enough of money to invest towards food they need for healthcare. But I have a feeling that we all need to prioritize parents that health care of children or pediatric of children is more important. So that should become a top priority of the. I'm sorry, I'm not apologizing anybody, but I know that should be the world explanation because our honorable on I hope you will not disrespect me. Honorable this president of America, he has dissociated, he has decided to dissociate from the WHO agenda. Anyway, I need to respect him in his present capacity. Yeah, Donald Trump, I remember Donald Trump in his capacity, president of America. But I'm of the brief belief that we also give topmost priority, not top priority of the health of children, and we also ensure that we should probably we have a lot of lessons to learn from what has been done in Switzerland, where I've traveled twice I've traveled. In every country, it's in Europe, but many countries have done a lot of innovative work in the area of pediatric health. From there, there are a lot of lessons to be learned. So probably with this small brief, I can end my presentation, and thank you so much.